Professor Moshabela, one of the questions I was asking is, since the confirmation then of this case of coronavirus in KZN, how are you responding from the war room that you've set up?
So our first response really is to change our alert level. Normally what we do, we draw in from the lessons we've learned from Singapore, and basically we prefer to start at level 1, where it's green, and then we go to level 2, where it's yellow, and level 3, where it's orange, and level 4, where it's red. Currently we have moved to level 2.
So what does level 2 entail?
So in level 1, it means that you're green, you don't have any cases with you, and so you tend to focus a lot on health awareness and just kind of helping people to understand what they need to do to kind of look after themselves, prevent disease and so forth. Level 2 then means that you have a case, but that case basically comes from outside. It means that you don't necessarily have the disease spreading around, but basically you have a case that can then be contained. So in this case, we've got one case that can be contained because we know the source is from outside. In level 3, that's when we start to have community spread. We've got people who are contracting the virus, but we don't know where they're contracting from. They haven't traveled anywhere else. They've been in the country, they've been locally, they don't have any contact with people who were sick, and so we don't know where they're getting it. So we then start to assume that the disease starts to spread. And in level 4, basically, it means that the disease is spreading more widely. And there's large numbers. I mean, in China, that's what we are seeing. In Italy. Yeah.
Sure. What are the interventions then that you need to have in place to ensure that it doesn't move from a level 1, as you're saying, or rather move from a level 2 to a level 3? Because it sounds like level 2 is still pretty much an area of containment, whereas level 3, you no longer have control of where it might go.
So that's a very good question. So at level 2, the most important thing is to make sure that the person who is infected is isolated, is treated, and is contained. The people who are going to trace are then going to identify all the different contacts. They isolate, they monitor them for symptoms, and they're able to treat them if they have symptoms. But a large responsibility lies with the population at large. So everybody needs to start to break the transmission of the virus. We don't necessarily know where it's going to appear at what point, whether you're at the airport or you're at the store. So we call upon everyone to be able to start engaging in hygienic practices. So that means that we need to then make sure that we are using hand hygiene, we are washing our hands, and we are not touching surfaces without making sure that they are cleaned first so that we don't acquire the virus. When you are sick, you either wear a mask, or when you cough, you use a cough hygiene into your elbow. You make sure that when you sneeze into your elbow, and you keep a distance from other people. You don't live, I mean, for our people at the university, we are saying if you're sick, stay at home and make sure that you can get help. Don't necessarily go out and start transmitting, even if you don't know whether it's coronavirus or not. And it's only through the testing that we will know what the disease is. So it is those measures that become really important, but they require a lot of behavior change, and they require a lot of responsibility. They require a lot of responsibility from the people themselves in the population. So that's the effort that we are going to step up. And unfortunately, when we started, we just simply wanted to focus on the university, but now this kind of creates pressure for us to start engaging with people even outside of the university, including in the city and also with the department.
Now, this particular case is said to be coming from the Midlands in your province, in KwaZulu-Natal. So I wonder then, when you look at the province in particular and the risk areas and the risk factors for that particular province, what might some of those be?
So the thing that is interesting about the province, and this was our argument when we set up the war room, is that the province is large and a lot of people in the province travel. We don't have control over that. For us, we are not necessarily going to assume that it's just in the Midlands is contained or it's in the South is contained. We're not going to make those assumptions. We need to adopt an approach that makes us understand that it can be anywhere and it needs to be prevented by everyone. I mean, it's important that everyone stays calm and we don't panic, but then if we understand our responsibility to make sure that we break the transmission, that is really what's going to help us to contain it. The authorities who are responding to a specific case will contain it where it is. But really, the responsibility that comes from everyone else is to make sure that we are prepared for any situation, including if we start picking it up in different other parts of the province. And so, for us, we are not necessarily going to make assumptions about whether it's going to be in this place or that place.
What kind of role then are you going to be playing going forward? And I wonder, will you be lending a hand in particular when it comes to not just the man that has tested positive, but of course the 9 others now that have been tracked down?
At this point, as the University of KwaZulu-Natal, we don't really need to do anything in terms of the specific case that has been identified, largely because it is still a small caseload, as we might call it in epidemiology, and the Department of Health, the NICD, they are quite capable of responding to that. Our people are engaging with the Department of Health, our clinical virologists, and our infectious disease specialists together with the NICD. What we are saying is, let's start preparing and pushing an effort whereby we start to break transmission, and we do it more widely. For us at the university, charity begins at home. We need to make sure that our staff, our students, they know what to do, they feel safe, they are calm, and they know what measures to take in order to break transmission and prevent spread.
All right, we're going to